It is National Rehabilitation Awareness Week. We are doing another one of our videos, getting to meet some of the team. We've been talking with staff all over the Mary Free Bed system, out in Saginaw. We got a video coming up from the team up in Munson and right here in West Michigan. We are taking another chance to talk about rehabilitation nursing. We are in the third floor of the rehab hospital. We're seeing patients kind of walking around on the terrace, and I'm here talking with Jenny. She is an RN here at Mary Free Bed. Jenny, why don't you introduce yourself? Tell me a little bit more about yourself and the team that you work on here at Mary Free Bed.
Awesome. Yeah, my name is Jenny. I have been at Mary Free Bed for 21 years total. I started as a nurse tech, and then my senior year, I interviewed and got a nursing position here, thinking I was going to stay for a short period of time and maybe like venture off into another field. And I've been here ever since. So 20 years as an RN, but 21 years total with Mary Free Bed.
It's Rehabilitation Awareness Week. What does rehab and rehabilitation mean to you and as a nurse here at Mary Free Bed?
So rehabilitation is basically trying to restore someone back to like optimal health and function, right? So someone who is disabled, has a chronic illness, we want to help them adapt to this altered lifestyle that they have now. Maybe do things a little bit differently than they're used to doing.
What, as in rehab, we can sometimes think of a physical therapist as like the first thing that comes up, or as a rehab doc. How does nursing fit into that whole team of rehabilitation?
So to be inpatient, they have to require 24-hour care from nurse and physician. So that means that they might have some complicated diagnosis where they cannot care for themselves, or it's not safe for them to go home and care for themselves at this point. They might have extensive medical history that needs, monitoring while they are in the healing process. So it could be, things like diabetes. They might have a significant cardiac history that needs monitoring of their blood pressure and maybe some lab work. Maybe we're treating, infections. So on top of that, we're also doing like wound care stuff with patients. So there's a real need for nurses in the rehab world.
There's so many different types of patients that we work with here. Are there any specific ones that you're a part of their team, or do you kind of jump around and help a lot of different types of patients?
So I actually work primarily on the spinal cord injury team. That's where I started, and that's where I've been since I started. So that's most of my population, but we also will, as a whole, the hospital treats our brain injury patients, maybe from, multi-traumas, motor vehicle accidents. We've also had, stroke patients that have come through. And occasionally, even on my team, we'll have those patients, move down to our unit, and we still have to know how to take care of them as well. So could just be some deconditioning or some weakness that someone is noticing, either from a chronic illness, or maybe they had a surgery and they were hospitalized for a while and they might just be weak from that. And so sometimes they just need a little bit of help as they're still healing and going through that process.
I've heard this from patients sometimes, especially on the spinal cord program, that they will need their nurses so much more at the beginning of their care. And sometimes spinal cord injury patients are at Mary Free Bed for months. So they might be really close with you and your team at the very beginning, but then they need you guys less. What's that like as you build these connections? Because that's something I've heard from rehab nurses, is they become part of the family. All the staff does here with their patients. Tell me specifically about that.
Yes, very true. This is not a place where patients are in and out in 2 days. We do really get to know our patients. We get to know their families. They kind of become part of our family here at Mary Free Bed. Sometimes it's difficult because when they leave, we, in a sense, kind of cut that connection because now they're off, doing their own thing. But that is part of actually what I enjoy about working here. It's just getting to know people, getting to see them perform and how well they can recover. Yeah.
So we are talking with Jenny, a CRRN here
Mhm.
at Mary Free Bed. And why don't you tell me about that too? Like you have a special certification that's needed here at Mary Free Bed and working with rehabilitation. What is that? How does that set you apart from other nurses?
Yeah, so the CRRN stands for Certified Rehabilitation Registered Nurse. So I actually went through some courses and was able to learn more about rehabilitation nursing and the things that I would specifically need to know to take care of my patients. It just gives you a better knowledge base of, you know, the diagnosis and the disability that they've occurred and kind of how to set up their care plan for while they're here.
You mentioned becoming like family with the patients. Have you had any like recent success stories with patients that really kind of hits at your heart and like, this is why I'm here and why I'm doing what I'm doing?
My gosh, there's been so many. I think the greatest thing is, when you have a patient who comes in and they can't move, they're in so much pain, to the point we can't hardly get them out of bed, blood pressure's dropping, and weeks, 3, 4 weeks down the road, now we've got their pain under control. They're up moving. They get excited because now they're wiggling their toe, or they were able to walk like 50 feet with the walker and a harness. And so we really celebrate those milestones with these patients. And we give them the opportunity. So on day of discharge, if they're ambulatory, they can walk out with a walker. We don't push them out in a chair. We let them walk and celebrate their successes.
And we're talking on the floor as patients are coming in and out. It's a really nice day. I can see some rec therapy, it looks like, going on. How often are patients using the terrace? We keep hearing the door open and close. Is this a popular place for patients to go to?
Yes, definitely, especially when the weather is nice, and we really encourage our patients to get out of their rooms. They do have single, like, private rooms, and so it can get a little lonely, and so when they have family that comes to visit and just being stuck in the 4 walls for so long, we're like, "Hey, there's a terrace. It's real easy. You just go out the door, and there's picnic tables out there that they can sit at. They can, have a snack, have a meal with their family out there." Oftentimes, our therapists actually will take them out and do some range of motion while they're sitting in the chair, maybe do some walking on the terrace. So that's really nice.
Every person I've talked to so far in these interviews, I felt like they've had their own personal reason, whether it's a family experience or something that they learned when they were younger. What got you into healthcare and wanting to become a nurse?
Honestly, when I was in high school, I was just thinking I wanted to go into some sort of healthcare. And Ironically, I originally wanted to be a physical therapist. My grandma was a physical therapist in the Army, and I just thought that was super cool. And then I started looking into things, and ultimately I decided that I was just going to go nursing, but I found Mary Free Bed while I was looking for a job at a hospital. And I was like, oh my gosh, a rehab hospital. I'm like, I wonder what they do there. So I started to do some research and applied for a job. And that's how I started as a nurse tech. And it was really cool because I could be part of a team where I really liked the idea of rehab, but then changed my mind and kind of went more towards the medical end of it, to taking care of patients on that aspect versus actually doing the physical therapy.
I hear that a lot too from our staff, where they might start as a nurse tech and then get their degree, become an RN, or even on the therapy side where they are a physical therapy assistant or just a rehab tech, and then they move into being a physical therapist. What was it like for you to make that move and that change?
Yeah, it was kind of nice because I knew the layout, I knew the workflow at the time. So I will say when I started, I knew nothing about spinal cord injury. I mostly worked actually with our stroke patients or brain injury patients, and they said, "Well, we have an opening for you on the spinal cord team." And I was like, "Okay, I can learn fast." And it's definitely, you know, uh, this part of nursing is definitely, it takes time to really get seasoned in this specialty. but I think over time, you learn so much, and it really is such a rewarding part of nursing.
So as we wrap up this interview, I appreciate you, Jenny, taking the time from your clinical work to talk with us today. Why should we be celebrating rehab, and why might someone want to go into rehab, and specifically being a rehab nurse?
Rehab is so important. There's been so many advances right now with technology and in medicine that allowing patients to thrive, to live through certain situations. And I think that, they need a place that they can come where we can really help to advance them, to really optimize their function, as much as possible. I think, as far as nursing goes, rehab is its own entity. It's just like any other place in nursing. Like you have oncology, they're very specialized. You have people that really love ER, or working in surgical rotation. Everything has its own little specialty ways of doing things. And when people think rehab nursing, they're like, well, what do you do? Because they all think physical therapy. And I'm like, well, there's much more to it than that. And we do see some more critically ill patients. We do, still have to do the IVs. We still have to do like some severe like wound care stuff. Not as much, because our goal is to take patient, kind of get them out of that sick role and work towards being well and being home with their family, and adapting to that new lifestyle. So it's definitely different. But it's a great team here. We really are like a big family. The nurses that I work with, I love everybody, and you have to work as a team. That's one thing. Like, this is not an individualized plan. You have to be able to, pitch in when people need help, and otherwise, it's the only way we get through the day.
Well, Jenny, thank you so much for joining us and talking today. Really appreciate you taking the time.
Thank you.
And this has been another video about National Rehabilitation Awareness Week. We are highlighting our teams all across the system: nurses, doctors, therapists, just learning more about why they do what they do and why rehabilitation is so important. Stay tuned to our social channels to find out more, to see more videos. If you're interested in getting to know our team, or wanting to volunteer or get a job here at Mary Free Bed across the system, you can go to maryfreebed.com and go to the careers page. Thank you so much. Thank you so much for watching, and stay well.